So Project SEMILLA is a volunteer group of U.S. and Nicaraguan physicians, and our goal is to improve emergency healthcare capacity in Latin America. Well, there is some capacity. There are some very enthusiastic healthcare providers within Nicaragua and also within the surrounding countries, but they struggle with a lack of resources and lack of access to information, and so these are the types of things that we try to help with. Well, it's very different, and it can be very, even imagining how to practice there can be very difficult for someone who's used to all the resources that we have in the U.S. So, while they have very enthusiastic staff, oftentimes, they're dealing with very crowded conditions, very little access to equipment. For instance, in a tertiary care hospital, which means, a hospital that is providing care to an entire region of Nicaragua, they may have only one 12-lead EKG machine. So that's one EKG machine for an entire hospital. So now imagine when that EKG machine, because it was donated and they don't have biotech, imagine that breaks down. Then they have an entire hospital that has no access or ability to take an EKG. And if you have a patient with chest pain, that can be, you can imagine, a big challenge. We're focused primarily on education, and so one of the things that they really struggle with is the lack of access to information, because information, secondary to things like copyrights can actually be very costly. And so because they are in a low resource setting and they don't have money to access, kind of the new journals, the new internet sites, things like that, we try to bring them the current information in a non-copyrighted way. So right now we've developed, actually, to date, we have 5 different courses that we provide for the whole range of emergency care providers. So we have courses that are aimed at faculty physicians, we have courses aimed at resident physicians, medical students, and even one course that's aimed at lay providers who want to provide first aid care. Well, Nicaragua is actually the second poorest country in this hemisphere, secondary only to Haiti. And so we were looking for a country within Central America, especially because, being based here in Los Angeles, we're actually sharing the same patient population, so it makes sense. At my public hospital, All of You Medical Center, about 70% of our patients are Spanish speaking. So, and there's such migration between Central America and the US and California, it just makes sense. We really are in it together because we're truly treating the same patients. Well, we hope that once we really refine the courses and have things set up in Nicaragua, that we can expand to other countries, specifically first within Central America, that are of the same kind of resource levels, because that would make the most sense. We've already taken some steps to doing that. In terms of this past trip, we ran the first instructor course for resuscitation. So we kind of handpicked the local experts within Nicaragua that are very interested in resuscitation care and started training them to teach alongside us in these courses, and with the goal of eventually having a full team within Nicaragua that's able to run the courses themselves. No, everyone has been very welcoming. I think, we always try to start with a dialogue and make sure that, when we're in country, that the Nicaraguan physicians feel like, we're all partners in this. This is not, we're coming down here to tell you how to do things the right way. This is, we're partners. We realize that we have access to some resources that you don't, and we want to share these with you. And, as I mentioned before, we're really treating a similar patient population. And so when we start off the courses, I often give an anecdote of, a patient case that I've seen. But after I give the case, I say, now the question is, did this case occur in Los Angeles or in Nicaragua? And everyone stops and thinks for a second, but even though it's a Nicaraguan patient, it's somebody that was a patient of mine in the hospital. So that's, to start from that common link that we have and grow from there. Everyone's very understanding that this is a collaboration. It's not, we're at one level or near at another.